Coming to Udarashula, most common. Patient comes to your clinic, sir. I have stomach ache. I have severe stomach ache in right side, left side, above, below, middle. In all the Udara Shula, here they have specially told for Pravahika Shula. But this point will fetch you results in all types of Udara Shula. So how it is to be done is my cursor visible here? So in this picture, see, I have highlighted these 2 points, right? So in these 2 points, or how it is told that anterior superior iliac spine. So from that, medially towards umbilicus. Again, here the importance of surface markings come. So and locate anterior superior iliac spine and umbilicus. So in that particular line, 2 angulis of the patient towards umbilicus. So 2 angulis above the towards umbilicus. When we do viddhakarma on these 2 points, immediately the pain will reduce. I had a patient, 7 or 8 year kid, who had severe pain, who had come to my OPD. I just told I'll just give you one small injection and you will be all right. So I just took these two particular points as told in Udarashula, and he has not yet got a single episode of Udarashula after that. So that fast it acts. Okay. Then coming to the next, Antravruddhi and Ashmari Shula. So in Antravruddhi Shula and Ashmari Shula, there is told that Tvacham Dhitva Angushta Madhye Dehecha Anga Vipariyat. So it is mostly commonly told as the point of Angushta Mula point. So it should be done in the lateral aspect of the great toe. When we draw a line from that margin of a nail laterally, and the horizontal line, this particular line, I'll just mark it. Uh, yeah. So laterally, if this particular line is drawn from the particular nail, and metatarsal joint, if this horizontal line is drawn wherever it meets, so from this point to this point, the midpoint of this, if we do with the karma, immediately the uh, what you say, the shula, Ashmari shula, the kidney stone pain, or Antarvruddhi shula immediately gets off. And it is seen that the stone which is less than 5 mm to 10 mm, it is thrown away, or it gets excreted by doing viddakarma on this particular point. So that effective it is there. So without a surgery, you can actually remove the stones from the patient, kidney stones, and it gives immediate relief from the pain of a kidney stone. Then Plihodara, Yakrutodara, I had told. Medially, 4 angulas above the Kurpara Sandhi, 4 angulas below the Kurpara Sandhi, and in between the Kaninika and Angushta. What is that? Kanishtika and Anamika, the ring finger and the little finger, in between the ring finger and the little finger. Again, Nasa Roge and Gandha Agrahana. So in that Nasa Agrevidya, in all kinds of Nasa Roga, whether it is DNS, Pratishaya, Anaha, there is a polyp, all kind of Nasa Roga, if we do with the on the tip of the nose, it gets patient will get relief. Coming to Katishula, again, I have told to know like importance of sorry importance of what you say surface markings. So here, when we palpate the anterior superior iliac spine, the line which is, if we draw by joining these two spines, the midpoint of that is known as L5. We get L5 vertebrae. So from there, again on paraspinal muscles, in between the two vertebrae, if we do Agnikarma and viddhakarma, the immediate pain of the Katishula, lower back pain, will be the patient will be get relief from that particular lower back pain. Then in Janusandhigata Vata, there are 4 points. So if you see, the points are marked with brown color. One with 4 points. One on the two on lateral side and two on medial side. So two on two 2 points near medial collateral ligament and lateral collateral ligament, and two in between the knee joint. So when we palpate a knee joint, when you see, if you try it right now also, there are process, like there is a process where you feel bony process on the lateral side. So these two are the lateral points which I have marked over there. And medially, just below the patella, there are two notches where you like where is a depression over there. So in that depression, if we do with the karma, there is immediate relief in Janu Shula. At least 10 to 20% of relief is seen in just one sitting. Then, as I told, in particular, most of the cases like plantar fasciitis, even calcaneum spur. So there we use Mritika Shalaka for doing Agnikarma on the most tender points on the plantar aspect. So if we use that, the most of the like pain is reduced in one sitting itself. More than 50 to 60% pain will be reduced if it is more severe. And apart from that, if we take Chiprasya Dvanguli Upari Vyadhet, that with the karma also will fetch you the results of lowering the intensity of the pain which the person is suffering from. So these were some of the common cases which I see in my OPD, which I practice in my OPD. There are other cases which I am still working on that. Like one case which I am working on is a patient where uh, he had underwent an operation of an eye, uh, of a right eye. He had undergone a cataract operation, cataract surgery, where the cataract was not yet matured, and the doctors have removed that lens and reinstalled the new lens. But after that, he had a complete loss of vision of a right eye. So I just asked how he drives a vehicle. No, sir, I drive with my one eye, which is proper. I drive with that one eye, he told. Then what about other eye? Sir, I do not see at all any from that other eye. So, okay, I told, can we try getting some vision in that particular eye? Then he accepted it. Do whatever you want, and please, you can, if you are, you can get my vision of that particular eye. I'll be more helpful. So now, till the day today, it is almost 2 months. He's coming every day doing Vidha of Netra Vikaras from me, and now he is able to see a shadow of when a beam of light is coming from the lateral aspect, he is able to see that. So, and with that patient, I have not given a single medicine internally. I am just doing with them. Every day, he comes in the evening, does with the and goes. That's all. So that powerful, that healing the Vidya Karma is doing in the patients. So I'm still working on it. I have not it included in this presentation because I'm still working on it. So maybe in next session or next discussion, I might include that thing, that case also. Okay. So there are few case like success story which I would like to discuss with you in this further slides. So very first case which I had got was a pregnant lady who was having uh, what you say Visarpa in her 4 months of pregnancy. She had got a Visarpa Visarpa from the back, and it has spread till the chest. From under the breast, it had spread till the chest. She was not telling it to anyone. Like there is a superstition that if we tell to people, it will increase more and more and it will be fatal. So she was not telling it to anyone. She later she went to allopathic doctor, and allopathic doctor told, no, you have to bear with this pain. As you are pregnant, we can't give any painkillers or any internal medication to pacify that particular pain. So he just prescribed one ointment which was giving her temporary relief for around 5 to 10 minutes, that's all. And she was bearing that pain for 2 months. She was bearing. Then someone referred it to me, and this was very first case to me for viddhakarma. And frankly speaking, I was also afraid to do viddhakarma on that, because first thing, she is pregnant, 4 months pregnant. Second thing, again, from back region till the sternum, it was entering to the Hridaya Pradesha, again Marma place. So I was a bit worried and tensed. But still, as told in Shastra, I just did Dvayanguli above the Kshipra Marma of all the four, like in the legs as well as in the hands. The very next day, when I asked her, how is the pain? She told, sir, I'm very grateful to you that, sir, after 2 years, I could sleep properly. Almost 50 to 60% pain has been reduced, sir. Sometimes having while shifting from one lateral position to other lateral position, I slightly get the pain. So with just one sitting, the pain was like the pain drastically came down. And I was attending this patient every week, every weekend. That time I was studying I was taking guidance under Dr. Chandrakumar Deshmukh sir in Pune. So he was having holidays on Saturdays and Sundays. So I used to visit my home, and I used to see patients over there and perform viddhakarma. So this was my first patient who was such a critical case, and with viddhakarma, it was all easy. Internally, I just gave Lagu Suta Shekhara Rasa, which is safe again, and churna combination of uh, Ushira, and I guess Musta, and one more drug. I am not remembering now. Only these two medications I have given internally, and within 20 days, almost 4 weeks, that too on every weekend I am doing viddhakarma, morning, evening, Saturdays and on Saturdays, and on Sundays morning, evening. So 4 viddhas on weekends was giving such a nice results to that particular patient. So this was my first case. So I'll on this video, this was second case where I have not at all prescribed internal medication, and the pain was completely almost 70 to 80% pain was reduced. I'll just play on this video. Is it audible?
No, sir.
No, sir.
Okay, just I'll I'll just tell what she's telling. She's like, she had fallen 7 months ago in the kitchen while doing some household work, and she had got pain in the left leg near her thighs, some dragging kind of pain. So she had come after that to me after 7 months. Like she told, there is some pain which is irritating me, because of which I am not able to sit down, even to do my shaucha vidhi, or to go to attend my natural call. Because in this rural areas there are rarely commodes available, so Indian style toilets are most frequently seen. So she was not able to sit. Okay, so for again, uh, for this, I would like to tell this is a samprapti of Vata Rakta, where there is a Aghata for that particular lady, and because of which they once Aghata is done, the first and foremost thing is which vitiated is Rakta, and then again Vatadi doshas. So mainly Vata is affected over here. Hence, Vata Rakta is told in Kshipra Marma 2 anguli above. So that Vidha was done. And 4 anguli below and above Janu Pradesha. Why? Because she was limping. Gridravat chalati iti gridrasi. So for gridrasi, what Vidha was told, that I had did. But the sequence of Vidya here matters. First, she had a fall. So Samprapti starts with Vata Rakta. So first we have to do Kshipra Marma. 2 angulis above the Kshipra Marma. I had taken all the 4 points. 2 angulis above the Kshipra Marma. And then I had taken 4 angula above and below joints, keeping the condition properly. Like the knee joint must be flexed. And within the 10 days, she got 70% relief. Within first day, the limping action was normal, but there was slight pain which she was telling. So I told, daily you come, I'll do with the, and you go. That's all. And within 10 days, 70 to 80% the pain was reduced. She was able to sit down. She was able to do her household work properly. So this was second case. Third case, this lady immediately came after the fall. So what had happened was, patient had fallen twice. In a day, she had fallen 2 times. So once while walking in the home, she slipped and she fell down. And she got hurt on the knee. So left knee. Okay. And next, while she was tying a cow in a cow shed, the cow kicked on the same knee. On the same knee, the cow kicked her. So the pain was severe. Nothing. Vata Rakta Samprapti. I didn't even take viddhakarma of knees. I just took all 4 Kshipra, 2 angula above the Kshipra, those 4 points. And within first day, there was 30% relief. Within second day of Vidya, 50% relief. And on third day, she was perfectly fine. I'm just showing the video over here. So this was the video taken uh, second on the second day. She told on the first day 30% was relief. Today 50% was relief, and on the third day it was completely relief. So this was third case, and fourth case. This girl, school girl, was having swelling over a calf muscle, and she was not able to walk properly. She was not able to play. And this girl is an artist in Yakshagana. She has to jump, she has to do certain poses and all. So she was not able to do that. She tried several allopathy medicines, everything she tried. Later she came to me. Here again, the she was afraid of the needle. So I told, okay, let it do be there. I'll just do Agnikarma with Swarna Shalaka on the particular points. So only by doing Agnikarma on the for 10 days on the most tender points on the calf muscle, she was completely fine. So this is her review, or this is her what you say after treatment, uh, the review from her. So this one more thing about complicated case where she had uh, cholelithiasis, gallbladder stones within her. So this is why complicated, because at the age of 12, she was diagnosed with thrombocytosis and was on steroidal medication. But the condition worsened further in 2017, where emergency her spleen was removed. In emergency, they have to told we should remove the spleen. Now she got married, everything was normal. She delivered a baby. After delivering a baby, after 1.5 months or so, she got severe abdominal pain. And on scan they revealed that there is a gallbladder stone, and they advised to remove the gallbladder there only. But they requested not to do so because she was having a baby, and she, like after that, after some days, we will come and remove the gallbladder. They accepted for that. But like I came to know about this case before, like after she went into OT. So they took it in OT. They placed a shunt in central bile duct, and sorry, common bile duct, and they discharged her. The pain increased severely, twice that of whatever she had of that of cholelithiasis. It increased severely, and she was not able to sleep, sit, and walk properly. Even she was not able to feed her baby properly. So every day I used to travel to her home, do viddhakarma of Udarashula. But before that, Shipra Marma Vidha, then Udarashula, and Agnikarma on the most tender points. So within 3 days, she was able to sit, feed her baby. Within her 7 days, her pain was reduced by almost 80 to 90%. And after 1 month scan, or after 1 month of continuous Vidya Karma and Agni Karma, I just told her to do scan. So there were no stones detected at all. I was simply giving some Pachana medicines to her internally and doing Vidya Karma and Agni Karma. So within 1 month, the stones in the gallbladders were not there. So this was my case number 5. Now this one more case where there was IVDP, severe back pain. Patient was not able to sit for 2 minutes or half a minute uh, on a particular place. He was not able to he used to just sleep, completely bedridden. So for going to take a bath also, he used to run. He used to lift a bucket. He used to pour it on his body and run back as such and sleep on the bed because he was having such a severe pain. This case I do at my hometown. I visit there every 15 days. So every 15 days once, he was undergoing Vidya Karma and Agni Karma. So Vidya Karma on Kshipra Marma, 2 angul is above Kshipra Marma, 4 angul is above below Janu because he was having Gridrasivat pain, and on the paraspinal muscles also. And Agni Karma on the most tender points I used to do. Apart from that, as I was visiting him for 15 days once, I had told him to do locally Arkapatra Sweda Matra Basti had taught his wife to administer around 20 ml Dhanvantara Taila, and Shamana Aushadhis I have given. So after the treatment of 2 months, the patient came walking to my clinic, which is on the first floor of my home. He came walking. So that was the great success. He was advised to do surgery. He was about to go next day to the for the surgery, but someone gave my reference, and we started the treatment. So within 2 months, this is the results you can see in the video. He came walking to my clinic. So next case is of wrist wrist drop. This is a recent case which I had treated. Patient had a history of continuous Ratri Jagarana for 3 to 4 days. And next day, he had a very heavy work where he had, which included lifting of heavy weights mainly. So there was some program in their home. So he has to do lot of work and mainly lifting heavy weights. So the moment after doing that work, immediately after that, he got a wrist drop. Immediately after that. So again, here Vata Rakta Samprapti, and here again when we see we should take the points of Khanja and Pangu, which is told in Sushruta Sarira 8 chapter 17 shloka, as I had told previously. So that point and 4 angulas below and above the Purparasana. So that I had taken, and Agnikarma on C5 to C7 nerve roots. Why? Because it is these nerve roots are supplying to the hands and are responsible for the radial and ulnar nerve, which are supplied to the hands and proper functioning of the hands. I'm sorry. So for that, to give bala to that particular nerve, I had started Agnikarma on C5 to C7 nerve roots. And in Shamana Aushadhis, mainly Balya Aushadhis I had given because Kshata had happened in that particular patient. So this was first day. There was no bala in the hand. If we lift hand also, it used to drop. See the results. On the third day, he got slight bala. He was able to move the hands. 1 week, he was able to do it straight. And after the 2 weeks, he was able to lift his hand above. So this is the reasons which we get in by doing viddhakarma and agnikarma. So he is now completely fine. Normally, he is doing all his routine works and all. So coming to the point, like how viddhakarma and agnikarma works. This is a probable guess which I have done. It is basically because of peripheral tactile receptors and large sensory fibers, which again it does local inhibition and the pain is reduced. But viddhakarma acts different in different vyadhis. The samprapti of viddhakarma acting on that particular vyadhi is different in various vyadhis. So this viddhakarma is not only related to pain. It works on manasika vyadhis too, apasmara, unmada, the cerebral palsy in children. All these vyadhis can be treated with viddhakarma, and also agnikarma. Yes, and agnikarma, yes, mainly almost in most of the cases, there is a vasodilation effect, raktavahinya visparana, that is vasodilation effect. But not all agnikarma will do dilation effect. As we had seen in Visuchika, if we do Parshnidaha agnikarma, it does contraction action and the fluid loss in the Visuchika stops. So again, the agnikarma, works differently in different vyadhis.